Radiographic parameters in distal radius fractures. The two common views done in distal radius fractures are the posterior-anterior view or the PA view and the lateral view. The parameters seen in the PA view are radial height, radial inclination, and ulnar variance, and that in the lateral view is dorsal or palmar tilt. Coming to the radial height. Radial height is seen in the PA view, and it is the distance between two parallel lines drawn perpendicular to the radial shaft. So first we draw a line along the radial shaft and then drop a perpendicular to it from the radial styloid tip. The second line is a perpendicular to this line from the distal end of ulnar head. And the distance between these two lines is the radial height. The normal radial height is 11 to 12 millimeters. You are also asked the acceptability criteria for reduction in distal radius fracture. So for radial height, the radial height should not be less than 5 mm of the normal radial height or as compared from the other side. Coming to the radial inclination. It is also seen in the PA view, and it is the angle between two lines. The first line is a line perpendicular to the radial shaft, and the second line is a line joining the distal end of the distal radioulnar joint to the radial styloid tip. This is also described as a line tangential to the distal radial articular surface. So the angle between these two lines is the radial inclination. The acceptability criteria is that the radial inclination should be at least 10 degree, or there should not be loss of more than 5 degree of radial inclination post reduction. Both these criteria are given in different sources. Coming to the third criteria, which is the ulnar variance. It is also seen in the posterior-anterior view, and it is the distance between two lines which are drawn perpendicular to the radial shaft. The first line is drawn parallel to the medial corner of the articular surface of the radius. So you draw a perpendicular to this line from the medial corner of the articular surface of the radius, which has also been described as the subchondral bone of lunate facet. So this is the lunate facet. So you have to draw a line through the subchondral bone, this thick subchondral bone, at the distal margin of the sigmoid notch. So the place where the ulna articulates with the distal radius is the sigmoid notch, and where the place where the sigmoid notch ends, that place at the level of the subchondral bone of the lunate facet, you have to draw a line. The second line is parallel to the distal most aspect of the articular surface of ulna. Now the distance between these two lines is the ulnar variance. Now if the ulnar line is more proximal, this is called as a negative ulnar variance, and if the line at the radius is more proximal, this is called as a positive ulnar variance. So this diagram shows a negative ulnar variance, and the normal ulnar variance is a negative ulnar variance of around 1 mm. The acceptability criteria is that the ulnar variance should not be more than 2 mm positive ulnar variance. Coming to the dorsal or volar tilt. It is seen in the true lateral view, and it is the angle between two lines. The first line is a line perpendicular to the radial shaft, and the second line is a line joining the dorsal and volar rims of the distal radius. So if the dorsal rim is more distal, this is known as a volar tilt, and if the volar rim is more distal, it will be known as a dorsal tilt. The normal dorsal or volar tilt is a volar tilt of 11 to 12 degree. The acceptability criteria is it should be at least neutral. There should not be any dorsal tilt. This dorsal or volar tilt also sometimes is known as palmar inclination. So friends, this was a discussion on the radiographic parameters seen in distal radius fractures. If you like these videos, please hit the like button and subscribe to the channel for further videos. Also, comment in the comment section regarding the topics you will like to be covered in the future videos. Thank you.